My mother's a nurse, and it's kind of in our family to be nurses, and I've never regretted it.
I decided to become a nurse because I wanted to help people out, and I wanted to help children especially.
I always look for ways to help somebody that needs it. So what better way to do it than to be a nurse?
Both helping people, but also practical for my family.
And I ended up in pediatrics because I didn't really like the hospital scene.
Instead of having like 25 clients versus the one, you know, it's hard to spread that out during an 8-hour shift or even a 12-hour if you got 25 or so patients. Home health was more for me.
I've been able to help a lot of children that have been in a very bad state to where they become extremely healthy, like my patient right now. She was 4 years old and she was wearing 18-month-old clothes. Today, she is very healthy, putting on so much weight that they can't believe it. And all of those little goals that we set along the way with her were just wonderful.
I started off in assisted living. I worked in Alzheimer's building, rehab, long-term care. I've worked in all of those. But I always had a love for children. I was actually a nanny before I was a nurse. So a friend of mine was doing pediatric home health and I decided to try that.
And once I got to home health, like I've seen like other opportunities, other things that have come my way, but like I picture myself doing that and I'm like, no, I don't want to leave what I'm doing.
You get to see them grow and you get to see their progress. Sometimes you have children who have a trach and then eventually they grow to lose the trach, so they graduate from the trach. You get to see all their progress, so you're there with their milestones, which I like.
I chose home health over a facility because when my kids were young, I wanted to have the flexibility to be at home more with them. It, allowed you to pick your schedule versus what their needs necessarily were.
At first I was hesitant to switch agencies because I just hate doing all the paperwork and all this stuff you gotta, do and jumping through all these hoops. But they made it pretty easy to join. So I really recommend anybody that wants to change agencies to go with Sonas.
And that's one thing about home health. It enlightens your observation skills a whole lot. You have to depend on your observation skills because you're the only one there.
Take advantage of all the opportunities that they offer you. As a new nurse, I never had any kind of vent or G-tube or trach experience, all stuff I've learned doing home health. I have friends that are RNs that I would work circles around because I have more equipment knowledge. I have more knowledge of different kinds of disease processes that you don't necessarily see all the time in the hospitals, just because they're out in the community. I think it's an awesome experience.